Are irregular cycles something to worry about? Is it normal to get a UTI every time you have sex?
No.
Pain during sex is too often brushed off. But what are 3 possible causes, and how can women actually deal with discomfort? And why are women so worried about the way they look down there? And we're back for another episode of the Girls Club. Isabelle, thank you so much for joining me. How are you feeling being here today?
I'm good. Thank you for the invitation.
I'm so happy you're here.
Glad to be able to share some, important details for a woman's life.
Good, I'm so glad. Can you give a brief introduction to why you're here today and who you are?
I'm Isabelle Saliba. I am a practicing gynecologist and obstetrician for the last 35 years. I worked at Mater Dei and Karen Gregg Hospital for many, many years, and I'm also practicing in the private sector.
Lovely.
I'm also a mother of 3 kids who have all grown up and left home, so leaves us with more time on our hands. Yes, but I love the subject and I'm very fond and keen on teaching.
Lovely. Well, this episode is going to be filled with information, but before we get into the questions, I'd like to say that this video is brought to you by Hero Mighty Patch. So let's begin. What does a healthy period actually look like?
Well, when we talk about menstrual cycles, first of all, the cycles normally begin at the average age of 12, 13. And they go on through all the reproductive years till the age, on average, of menopause at around 52. Mm-hmm. Now, throughout this, in the beginning and in the end of the menstrual life cycle, then there's always going to be a bit of irregularity till the cycles settle down initially and then till the cycles come to stop. Mm-hmm. And all this is related to how your ovaries are working. Okay, so when we come into menarche or puberty, so that is the time when we start getting the physical changes, so the breasts start to grow, the girl becomes taller, she starts to develop hair in underneath her armpits and in the pubic area. Very often there's a little bit of acne and hair growth in different regions. So this is the time when the girl starts to be exposed to the hormones that are mainly coming from the ovary. Now, the ovary works in a cycle, okay, and this cycle is dependent on hormones that come from the brain. So it's basically the brain that triggers this function of the ovary. So the ovary starts to develop eggs. The eggs produce hormones. The hormones affect the uterus. We ovulate mid-cycle, so then we get a second hormone, which is progesterone, which also has its effect on the body. So we start getting the breast tenderness, the little bit of anxiety that we get before the period. And then you get your period, right? Now, till the ovary settles down, you will get some irregularity. But normally, after about 2 years of the first period, you'll develop your cycle. Now, not everybody is the same.
Okay.
There are women who will have periods regularly every 28, 30 days, 26 days. And there are others who'll have periods every 40 days. That does not make them abnormal, okay? What we become a little bit concerned about is when women don't get periods for 2-3 months, or else they've had regular periods and then all of a sudden they start to become irregular. Now, apart from the regularity of the period, it's how much you actually bleed.
Okay.
Okay, so there are some women who get heavier periods, and there are some women who get not so much. So they get a little bit. Mm-hmm. Sometimes it's, 1-2 days of a little bit of red and then a couple of days of a little bit of brown. And that is normal. It is also normal that sometimes in the middle of the month, at around ovulation, you get a little bit of spotting. You get a little bit of blood. And that can happen in a considerable amount of number of women. Sometimes it'll never happen, and then all of a sudden it starts to happen. Again, if it is exactly mid-cycle at the time of ovulation, then that is considered normal. Sometimes periods are a bit heavier, so you get a little bit of blood clots in the period, but obviously they can't be very big, otherwise it's something that you need to report. But any change from your normality then can be abnormal. And once a woman gets her periods, I think it's important for her to take note of what her cycle is like. So they should keep a menstrual calendar. There's lots of apps on the telephone.
I think I have too many.
You just track your period and it's really convenient. If you don't have that, then you just keep a menstrual calendar. Now, if a woman starts experiencing heavier periods, so the presence of larger blood clots, bleeding that is keeping her indoors, bleeding that she's having to change her pads much more frequently, bleeding that is making her wake up at night, otherwise she soils the bed, bleeding that can occur at wrong times of the cycle. So if it doesn't happen exactly at the period or mid-cycle, but happens at other times, then these are things that a woman, it's important for her to take record and take note so she can speak to her doctor about.
And that would be the time where you'd say like, okay, something's wrong. So when you'd be having a normal cycle, then all of a sudden it goes to like an extreme.
Exactly. So if there are changes, and sometimes the changes can be subtle. So for example, sometimes if you're on some medication, some medication for something completely unrelated, so for example, medication for the stomach, you can start spotting a little bit before your period. So before your period actually comes, from a few days before, you'll start seeing some blood. Again, if there's a change, then it's important to note this change, and if there's a pattern to the change. It's also abnormal if a woman starts experiencing blood after intercourse. Okay. So it's not normal for a woman, for the first couple of times it's normal. But then it's not normal for a woman to have blood after sex.
Why is it not normal?
Because it can reflect an infection, but it can mean more sinister things. Okay, so health of the cervix, for example. There could be simple things like a small polyp or an ectropion. In Maltese, we call it the barsha. Okay, the barsha, not a scratch. It's a hormonal change on the cervix, but that can make you bleed with contact. But it can mean changes on the cervix which are abnormal and should be looked into and possibly treated.
Are irregular cycles something to worry about?
Again, every woman has her own cycle. So if there is an irregularity to what her normal pattern is, then you need to look into it. So for example, a very common complaint or a very common condition is polycystic ovarian syndrome. So this is a condition which is inherited. It's very common. 25% of women have it to some degree, but it is associated with irregular periods. If you gain weight, then your periods are going to go even more abnormal, or rather, you won't get it.
If you gain weight?
If you gain weight. Because polycystic ovary is a condition that is associated with diabetes and the condition that is dependent on your insulin sensitivity. So if you gain weight, you become more insensitive to the hormone insulin, which controls your blood sugar, and your periods go even more haywire. So one, advice I would give patients or ladies who have been diagnosed with polycystic ovary is to watch your lifestyle. Be careful with your weight, do some physical exercise, avoid sugars, because it's very important for your ovarian health and even future fertility, and avoidance of becoming diabetic in the future.
So in your opinion, what are 3 daily habits, women should follow or avoid to keep their vagina as an overall healthy?
Okay, now we're going to something else. Vaginal health. Well, I think hygiene is obviously very important. So again, you don't have to go to extreme. We don't have to wash ourselves 3 times a day. Twice a day is enough, unless you're suffering from something in particular. Another nasty habit is the wearing of panty liners on a regular basis.
Okay.
Because panty liners, there are lots of women who say, no, I can't live without my panty liner. But panty liners are actually very unhealthy. Because
and why is that?
Because the vulval skin needs to breathe. Okay. You're making it a moist environment. And thrush, for example, fungus, which is a normal commensal on everybody's skin, so everybody has it on the skin, but in the right environment, then it will grow even more. And diet is very important for vaginal health, because if you're eating a lot of sugars, if you're drinking soft drinks, if you're taking a lot of alcohol, then you're going to run the risk of having more vaginal fungal infections. Another very common infection in the vagina is bacterial vaginosis, which again can occur more in women with multiple partners. Okay. Use of antibiotics, because they will alter your normal bacteria, so the bacteria which are there to protect you. Okay.
It makes it a bit weaker in a sense.
It makes it a bit weaker because it kills off the normal defense bacteria that you have.
For sure. And how do you deal with vaginal odor and discharge and stop it from happening?
So again, many women think that discharge is abnormal, but in fact, discharge in the majority is physiological. So when you start getting your periods, up until the time of menopause, you will have vaginal discharge. And if you don't have it, it's abnormal. When you go into the menopause, then vaginal discharge will stop. Before menarche, so before you start getting your periods, you will not have much vaginal discharge. And the presence of vaginal discharge at that age usually means some form of infection. And the commonest infection in young girls is usually actually worms.
Okay.
From the back, which will cause irritation and discharge in the vulval vaginal area. Now, in the menstrual years, so between 12, 13 to 52, but again, this range is variable, then the commonest infections are bacterial vaginosis, which is what we've mentioned. So it's an overgrowth of certain types of bacteria, which will give you this sort of fishy smell, greenish discharge, but no itching. Okay, but it's very fastidious, especially the smell tends to get worse after sexual intercourse. And thrush, which normally gives you a lot of discharge. It's usually clumpy, whitish green, but then it will be associated with with erythema, with itching, with swelling, and a lot of discomfort, and then very often with burning pee as well. There are other infections, obviously. So if you start getting discharge, sorry, let me go back a little bit.
No problem.
So physiologically on a normal cycle, you will have discharge, and the discharge will change throughout the month. So after your period, it tends to be a little bit thicker, whitish, perhaps a little bit yellow. At the time of ovulation, it will become very clear and more copious and stretchy. In fact, people who are planning to get pregnant sometimes use that to know that their ovulation is approaching, and obviously their fertile period, it's when they have to try to get pregnant. Once ovulation is passed, then the discharge will change again and become a little bit thicker, whitish, sometimes a little bit yellow. Now, if you see that the discharge is increasing a lot, or there's itching, or there's discomfort, or there's swelling, or there's a bad smell, then something's going on. And sometimes the changes will be a little bit cyclical. So you tend to get more symptoms in the week before the period, for example. Thrush tends to be exacerbated or made worse at the time just before the period. And this is associated to the alteration in the pH of the vagina, because the vagina is actually a bit acidic. Mm-hmm. This is when you're young, sometimes the discharge actually makes holes in your panties, because the discharge is acidic. And that is one protection we have against infection.
So would you say that not getting discharge is a form of being unhealthy?
Yes. Every young woman will have discharge, and that is normal. Now, abnormality is when there's a change in this, or there's a lot of it, or there's itching, or there's a bad smell, or there's swelling. Then this is when you need to obviously report it. And sometimes this may represent a sexually transmitted infection. Okay, which is another thing that girls and young ladies and ladies in general need to be on the lookout for. Okay, so having unprotected sex, especially with multiple partners or partners that you're first becoming exposed to, puts you at risk of developing sexually transmitted infections. Sexually transmitted infections, there's a whole range. Okay, one of the commonest is human papillomavirus, which unfortunately is highly contagious. So per sexual act, you actually run the risk of about 50% of getting it. Okay, so they can't say, oh, I've only had sex once, or you still run the risk of getting it. Chlamydia is another, highly contagious infection, which per sexual act runs the risk of about 20-30% of getting it. Now, again, a lot of people will think, oh, okay, but I didn't have penetration. For them, sex is vaginal, penile sex, and that's it. But really, other forms of sex also run the risk of transmitting certain infections, including HPV, chlamydia, gonorrhea, and other things like syphilis, HIV, etc.
So what would you say are the best ways to prevent getting a sexually transmitted disease?
Well, I think safe sexual practices is really, what we can do. There are obviously barrier methods of contraception. If you're in a new relationship, if you're not in a stable relationship, then definitely I would advise for everybody to use barrier methods. HPV, there's the vaccines. So, young girls and boys nowadays are all being vaccinated at school. But even if, in the older generations, so 20s, 30s, even 40s, I still advise taking the vaccine, especially in somebody who is going into or embarking into a new relationship, because you never know what that relationship is going to, bring with it.
Yeah, for sure.
Okay, something nice and something not so nice.
So UTIs after sex are super common.
Yes.
Can you share the top must-dos to prevent UTIs after sex?
UTIs in women are extremely common, and this is basically due to our anatomy. Okay, the bladder is situated right by the vagina, and the pipe from the bladder to the outside in women is very short. So it's very common with the sexual act for bacteria to become pushed into the bladder.
Okay.
So it's very important for a woman to drink a lot of water, to always keep the bladder flushed. Before sex, you should always pass urine so that the bladder is empty, so there's less friction on the bladder. Again, always pass urine after the sexual act, so any bacteria that have been pushed in are actually flushed out. In somebody who has had repeated UTIs, then taking probiotics will help. And in the older woman, using a lubricant. Because if the vagina is dry, then there's more risk of friction against the bladder. So lubrication is also very important.
And is it normal to get a UTI every time you have sex?
No.
And if that's the case, what's wrong?
Then ideally you get the urine checked, because there may be a bacterium that you have not treated properly or adequately. So if you've got a UTI, if you've got full-blown symptoms like, a lot of burning when you pass urine, a lot of discomfort, especially when you stop passing urine, frequency, you have to get up at night, sometimes they'll see blood in the urine. So if they've got full-blown symptoms, ideally you'd get a urine sample checked to see what bacterium we're dealing with and what antibiotics are appropriate for that infection.
Wow.
Okay. Some women will start a course and not continue it. Then
that's bad.
That's very bad, because number one, you're creating resistance. So the bacterium itself will become resistant to the antibiotic. And two, you're not treating it properly. And in these scenarios, it causes even more problems, because the bladder then can become chronically infected and become very difficult to treat.
So it's basically incurable then?
It's not incurable.
Okay. That's
but
good.
It's more difficult to treat.
Moving on to a bit more of the sex part of this all. Pain during sex is too often brushed off, but what are 3 possible causes, and how can women actually deal with discomfort?
Okay, so let's elaborate a little bit about what pain during sex actually is. So first of all, the medical term for it is called dyspareunia. And painful sex can be pain on the outside, so superficial, or it can be a tummy ache. Okay? Now, superficial dyspareunia, so pain in the vulvar area, usually means it will happen in the beginning, obviously, but that'll pass away. But it usually means some superficial irritation, perhaps due to dryness. Sometimes it's psychological. Okay, so if the woman has been through some traumatic event in the past, then they can develop vaginismus, where the muscles around the entry of the vagina become very tight and it's a painful experience. On the other hand, pain can be in the tummy. So when you have sex, you can get a little bit of pain at the time of the sexual activity. That usually doesn't mean much. And it can be associated with the position of the uterus. So in most women, the uterus is tilted forward on the bladder, but in some it's tilted back. And in those women, when the uterus is tilted back, then the direction of impact, if you like, during sex is more pressure on the uterus. So that causes a little bit of discomfort, but that passes, immediately, practically immediately after. If there's a lot of pain during sex, and especially if the woman remains in pain after, then that may signify that there's something more serious, okay? Like endometriosis, okay, which is another chronic condition that can affect women, and in simple terms means that when you get your period, rather than your period all coming out, some of it actually goes on the inside, or else you have spots on the inside which are bleeding as well during the time of your period.
And how would you know if you have something like that?
Usually there's quite a bit of pain. There's pain on sexual intercourse. There's pain that lasts a couple of days after you've had sex. Usually they've got very painful periods, but pain not only during the period, but pain that even precedes the periods by a number of days. Another cause is pelvic inflammatory disease. So we mentioned sexually transmitted infections. So the importance of chlamydia, gonorrhea are that unless they're diagnosed at the right time, and a lot of them are asymptomatic. So chlamydia, about 85%, you'll have it and you have no symptoms at all. So I would advise that women going into new sexual relationships when they don't really know much of the sexual history of the partner, to protect themselves and others, is to get a GU screen. Okay, the GU clinic at Mater Dei, Mosta Health Center, there's lots of places where you can get a GU screen, is to do one, just to make sure that you remain healthy, because the long-term consequences of these may be significant, like infertility. Okay, because if you cause damage to your tubes, then you're unable to get pregnant.
Why do you think some people are so scared, and why do you think it's such a taboo for people to not have the approach that you're recommending, that they should go and get tested?
Well, the problem is, I think, a question of self-esteem, dignity, pride. So if you end up with genital warts, for example, it can be pretty psychologically devastating. Now, luckily, that is something that we can treat. Chlamydia, gonorrhea is something that we can treat. But sometimes the damage that they cause is we can't treat, So I think it's very important that people actually seek, medical opinions before, either embarking on something, or at least they get checked up.
For sure. And you're mentioning a bit about body image and everything. And something I wish to touch on is there even such a thing as a normal vagina?
Yes, I think it doesn't mean one size fits all. We're all different. But, it's, yes, a vagina is normal. There are some abnormalities which are congenital. So sometimes you will be born with an abnormally shaped uterus that can also affect your vagina. But that's not common. That's not common. A vagina will also be affected after childbirth. Okay, so when you've had childbirth, when you've had big babies, when you've had instrumental deliveries, for example, if you've needed help to get the baby out, then sometimes the vagina will be damaged, and you will get some prolapse of the walls of the vagina, which is something that, menopausal women suffer a lot with. A little bit of collapse of the vaginal walls.
And is there any way to cure? I'm not sure if curing is the word, but is there any way to
Well, there are surgical, if there is something, like if you've got prolapse, if your bladder has come down, then there are surgical methods that we can do, or other methods. Some women get a little bit obsessed about how they look on the outside.
Yeah.
So how the vulva appears. This is too long, this is too short, this is too narrow, this is too... So yes, you get lots of complaints. But again, it's, we're all different.
Yeah.
Okay, we're all different in the vulva in itself is, so the external part of the female genital tract is different,
And why are women so worried about the way they look down there?
I think perhaps this stems a little bit from, social media, films, and expectations. But again, everybody has to realize that we're not all made in the same way. Just because you see a picture of a perfect vulva, what you think is perfect, doesn't mean that's normal.
The way. Yeah.
There's a lot of cosmetic surgery nowadays, so you don't really know if that is the way God has made them. Everybody has labia majora, everybody has labia minora. So these are the folds of skin around the opening of the vagina. They're not all equal. Sometimes they're long, sometimes they're short. If they're very long, yes, then they're uncomfortable, and surgically, we do it quite a bit, that we reduce the labia because they become very uncomfortable. But again, there's a range of normality.
But I think it's comforting for people to know that this information, because I think sometimes you feel a bit like alone in a sense, like, is it just me? Am I abnormal? Do I have like a weird, So I think it's very comforting for women to find out that it's normal to not have the perfect, you know what I mean? So
I don't think there's such a thing as a perfect vulva or a perfect, shape.
For sure.
The general shape is the same, but everybody's different.
Everyone's different.
Yes. In terms of size, in terms of length, in terms of pigmentation, in terms of color. We're not all the same.
No. I wish to move on to something different for the last bit of this episode. I wish to touch on contraceptive pills. Is the pill still the best option for a woman, or are we just used to it?
No, again, contraception is a very, very, very vast subject. And it very much depends on the woman herself. Not only on what she would like, but what she can take. So there are, for example, women with some medical conditions, women who have had certain problems in the past, where methods of contraception are safer than others. So the pill is commonly used not only as a contraceptive, but for cycle control, for women who don't get periods regularly, for polycystic ovary, for pain, for irregular periods, women who have a lot of acne or hirsutism, so hair growth. So we can use the pill for a lot of things. There are two types of pills. There's the combined pill, so estrogen, progesterone, and there's the progesterone-only pill, which we use in breastfeeding women who suffer from migraines. But no, there are other methods. So there's the longer-acting methods of contraception, like coils, which can be hormonal or non-hormonal. There's the barrier methods of contraception. There are the implants, and there's also sterilization.
And what would you say is the safest for a woman? Something that doesn't have all the side effects?
It all depends on the patient, on the woman herself. Is she planning a pregnancy in the near future? Is her family complete? Is she adverse to certain things? Is she going to be compliant with the method of contraception that you give her? Because the pill, obviously, if I prescribe it to you, then you need to take it. I'm not going to come home every day and make you swallow a tablet.
Yeah, for sure.
So if you're not prepared to make that commitment, then you can't depend on it, because the pill will not work if you miss it, if you take it erratically. On the other hand, methods like the intrauterine system, which releases a little bit of progesterone, so the Mirena is the commonest one that we use, that is a very, very good, completely reversible method of contraception. And it is also good in women, for example, who suffer from migraine, because it is progesterone only. So it's a very safe, reliable method of contraception.
And is there a specific age that you'd say is the best age to start a contraceptive?
I think any woman who is sexually active should seek advice about contraception before she becomes sexually active. Because unwanted pregnancies in teenagers, for example, carries a huge, social, a lot of burden.
For sure.
Okay.
For sure.
I'm not saying it's something unwanted or bad, But there are repercussions. And I think, going into a pregnancy, a woman should know what that entails.
And she should be prepared.
What's
your take on male contraceptives? I feel like this has been the talk on social media quite
Yes,
quite
men
a bit
tend
now.
to say, "Halli fidejk." It's like it's your responsibility. It's our responsibility. Well, men in general don't like to use barriers. They don't like condoms. But I think it's very important, and the woman needs to stand her ground, especially, as we said, in new relationships and when you don't really know, much about the partner. Well, a definitive method of male contraception is vasectomy. But again, that is an irreversible method and should only be applied in, stable relationships where family complete and at an older age group. I mean, I wouldn't offer a vasectomy to somebody who's in their early 30s, with the possibility of having children later on.
For sure. Well, that's pretty much it. You did a fabulous job.
Thank you for having me.
Thank you, Isabelle, for coming on my show. It was a pleasure speaking to you. Lastly, this video was brought to you by Hero Mighty Patch, and we'll see you in the next episode.